Today we are going to discuss about the basic principles of orthodontic appliances. So coming to aims, the aims of the orthodontic appliances. So before going to discuss about the aims of the orthodontic appliances, the aims of the orthodontic treatment is to improve the aesthetics and function of the orofacial region. So in order to improve the aesthetics and function of the orofacial region, we need to apply the forces onto the tool by means of certain appliances. And these appliances are termed in general as the orthodontic appliances. So what is an orthodontic appliance? An orthodontic appliances are devices by means of which mild pressure may be applied to a tooth or group of teeth and their supporting structure so as to bring about necessary changes within the bone which will allow tooth movement. So it is simple to remember. There is nothing so hard. There is the orthodontic appliances. What are these appliances? These are generally the devices. The devices by means of which mild pressure may be applied onto a tooth. So with the help of these devices, mild pressure is applied onto the tooth or a group of teeth and their supporting structures such as TDL so as to bring about the necessary changes within the bone. So because of the application of this pressure onto the tooth and the supporting structures, there are certain changes which are produced within the bone. These changes will allow the tooth movement. So this is the definition of the orthodontic appliance. Now coming to the classification of orthodontic appliances. The orthodontic appliances are basically classified into mechanical appliances and myofunctional appliances. The mechanical appliances are those appliances which apply pressure onto the tooth so that the tooth movement can be seen. And further, these mechanical appliances are classified into removable appliances and fixed appliances. And when coming to these fixed appliances, the movement of the tooth is bring about or brought about by the active components of these fixed appliances, which are the springs, elastics, screws, bolts, and retractors. Next, coming to the myofunctional appliances, contrast or contrary to the mechanical appliances. The myofunctional appliances, they take the help of the muscle function and they cause about the change. And these are also divided into removable and fixed appliances. So these myofunctional appliances, what they do, they harness the natural forces of the orofacial musculature. So the natural forces which are delivered from the orofacial musculature, these are carried forward onto the teeth and the alveolar bone by means of these myofunctional appliances. These myofunctional appliances transmit, eliminate, or guide the natural perioral muscles onto the dentition. So they transmit the forces or eliminate the forces. These are the undesirable forces or guide the natural perioral muscle force onto the dentition. Unlike mechanical appliances, the myofunctional appliances usually do not contain active components. The point to be remembered, mechanical appliances, there are active components as we have discussed, that is the springs, goes in the fixed appliances, the springs, elastics, what they will do, they apply some force onto the tooth and they cause some tooth movement. Whereas in myofunctional appliances, there are no such active components. So it gets to me a point that there is no tooth movement possibility with the myofunctional appliances. So, for what these are used? These functional appliances are used for growth modification procedure that are aimed at intercepting and treating jaw discrepancies. So, these mechanical appliances, they will cause the tooth movement, but whereas the myofunctional appliances, they are used for growth modification procedures that are aimed at intercepting and treating the jaw discrepancies. Now, to cause or to uh, achieve such such amount of changes by these appliances, there are certain properties or ideal requirements which have to be fulfilled by these orthodontic appliances. So, in general, these requirements are classified or headed under these four headings. Those are the biological requirements, mechanical requirements, aesthetic requirements, and hygienic requirements. Coming to biological requirements, the appliances, the term biological requirement means the requirements which will help or which are in favor of the biologic environment. So the appliance should bring about the desired tooth movement, first thing. And the second point is the orthodontic appliance should not produce pathologic changes. Pathologic changes should not be produced by these orthodontic appliances. And these pathological changes are root resorption, periodontal damage, and non-vitality of tooth. The third point is the appliance should not interfere with normal growth pattern and it should not interfere with normal function. The appliance should not bring about sudden changes. So these are the biological requirements and the next requirements are it should not bring about the unwanted tooth movement. The material used for fabrication should be biocompatible. It should not produce toxic effects. The appliance should not disintegrate in oral fluids. So once again, coming to the biological requirements, first point is it should not bring about, it should bring about the first thing, it should bring about the desired tooth movement. And while bringing such a movement, it should not produce pathologic changes, which are the root resorption, periodontal damage, and non-vitality of teeth. And the appliance should not interfere with normal growth pattern, should not interfere with normal function, and should not bring about sudden changes. It should not bring about unwanted tooth movements. And the material used for the fabrication should be biocompatible and should not produce toxic effects. The appliance should not disintegrate in oral fluids. Now coming to the mechanical requirements, those were the biological requirements. Now coming to the mechanical requirements, the appliance should be simple to fabricate. So the fabrication should be as simple as possible and it should not be bulky. It should not be bulky. So the patient should be comfortable in using them. The appliance should be strong enough to withstand the masticating forces. The appliance should be able to deliver controlled force. It should apply a force of desired intensity, direction, and duration. The appliance should be universally applicable, that is, it must be able to handle various small occlusions. Now coming to the hygienic requirements. The orthodontic appliance should ideally be self-cleansing. If not, it should be easy to clean them. The appliance should not interfere with oral hygiene maintenance. That is, the appliance should be self-cleansing. Self-cleansing in the sense, the appliance should be well polished such that no food debris should be adhered to the surface of the appliance. And if at all it interferes with the self-cleansing, at least it should be easy to clean them by the patients. So in such a way, the oral hygiene maintenance of the patient should not be disturbed or should not be interfered. Now coming to the aesthetic requirements. The orthodontic appliance should be aesthetically applicable. It is desired to have an appliance that is as inconspicuous as possible. Means the visibility of the appliance while talking or smiling should be as minimum as possible. Now coming to the advantage of the removable appliances. The first advantage is the removable nature of the appliance itself is the first advantage as it makes possible for the patient to maintain good oral hygiene during orthodontic therapy. In addition, the appliance can be kept clean by the patient. The second advantage is most malocclusions requiring tipping type of tooth movement can be readily carried out using the removal appliance. So tipping type of movement is a simple movement and it can be readily carried out by using the removable appliances. Many tooth movements like tipping, overbite reduction, they can be undertaken by the removable appliances. Now, the removable appliances are fabricated in the laboratory, utilizing nucleus chair time for the orthodontist. Since it is fabricated in the laboratory, And entire time-consuming thing is completed in the laboratory. The chair time of the chair set time of the orthodontist is very less. Just you have to check for the fitting of the appliance inside the patient's mouth oral cavity, and then you are done with the insertion part. As these appliances take less chair side time, the orthodontist can handle more number of patients. And the removal appliances bring about of tipping tooth movement, thus lesser forces are used than those needed for bodily tooth movement. As forces on cloud are less, strain on the anchor teeth is lesser than fixed appliance therapy. So, since the removal appliances, they bring out tipping type of movement, and the tipping type of tooth movement require less forces. Thereby, the forces applied by the removal appliances are very less, and the strain on the anchor teeth also less when compared to the fixed appliance therapy. Removal appliance can be used by general dental practitioner who have received adequate training. This makes it possible for the specialist to concentrate more difficult cases. The fabrication of removal appliances need less inventory and they are relatively less expensive than the fixed appliance. As removal appliances take less chair time and are by far less expensive than fixed appliances, they can be used for community-based programs wherein a large number of patients are treated. And the removal appliances are less conspicuous than the multi-banded fixed appliances. Damaged appliances that apply undesirable forces can be easily removed by the patient. So whenever you plan for a community-based program or camps where you want to correct a small amount of anterior spacings and all, you can do it by delivering the removal appliance since it takes less time. And also they are less visible when compared to fixed appliances. And whenever these removal appliances are damaged, the patient can just remove it and keep aside when compared to the fixed appliances. As the appliance can be removed, patient cooperation is vitally important for the success of the treatment. This is the first and foremost disadvantage of removal appliance. Patient is not cooperative. What he will do, will just take the removal appliance and throw it aside. So you can't monitor the patient. The removal appliances are capable of only tipping tooth movements. This is also a major limitation since only tipping movement doesn't solve all the occlusion problems. Whenever multiple tooth movements are to be carried out, it should be done one at a time. Thus, the treatment duration is prolonged in case of severe malocclusion. For example, when a patient is having rotations and crowding and spacing, first you have to correct the rotation, then you have to correct the crowding, and then you have to close spaces, which requires more amount of time. So the multiple rotations are difficult to treat in removal appliance because only single tooth movement is possible. In cases requiring extraction, it is very difficult to close residual space by forward movement of the posterior teeth. As the appliances are removable, there is a greater chance of patient misplacing or damaging them. Just he will be removing the appliance while eating or while sleeping. What he will do, he'll place aside. There may be a chance that the appliance may just drop down from the place or damaged. And the patient should exhibit enough skill to remove and replace the appliance without distorting them. They cannot be used to treat severe cases of class 2 and class 3 malocclusions with unfavorable growth patterns. So those are the disadvantage and advantage of the remote appliance. Now coming to the advantage of the fixed appliances. The patient cooperation is dispensed with to a large extent in the use of fixed appliance. The orthodontist does not depend on the patient for timely wear and management of the appliance. Where there was the main disadvantage for the removal appliances, this is the main advantage of the fixed appliance. Patient cannot remove or insert the appliance by himself. Only the orthodontist can do it. So patient cooperation is not so important for the fixed appliance when compared to the removal appliance. It is possible to bring about various type of tooth movements such as tipping, bodily movement, rotation, inclusion and extrusion, whatever you need. The multiple tooth movements are possible with the fixed appliances. Multiple tooth movements are possible simultaneously. As many tooth movements are undertaken at the same time, the treatment duration is also considerably reduced. More precise tooth movements and detailing of occlusion is possible using the fixed appliance. Fixed appliances can be used to treat most malocclusions, including very complicated ones. Fixed appliances offer better control over anchorage. So these are the advantages of fixed appliances. Then coming to the disadvantages, the most important disadvantage is oral hygiene maintenance. See, in removal appliance, you can remove the appliance and you can clean it outside. But whereas for fixed appliances, you can't remove it. So maintaining the oral hygiene is very much important and it is also difficult. Fixed appliances are more time consuming to fix and they take up more chairs at time, unlike removal appliance. So don't get confused. The chairs and time is more for fixed appliance, but the overall treatment duration will be less when compared to the removal appliance. Fixed appliances are more conspicuous than fixed removal appliance because the visibility of the multi-banded appliances is more. Fixed orthodontic appliances require special training of the operator and are invariably handled by specialized orthodontists. Damaged appliances that apply misdirected forces cannot be removed by the patient. As we have discussed earlier, whenever there is a damage in the remote appliance and unwanted forces are applied, the patient can remove by himself. Whereas for fixed appliance, the patient cannot remove. He should definitely visit the orthodontist to get corrected. Patient has to visit orthodontist at regular intervals and it is most expensive. There is a greater possibility of producing adverse tooth movements because in what way it is because when the patient is not coming regularly for the appointment, what will happen? The adverse tooth movements are not monitored by the orthodontist, and then there may be a greater possibility of producing these adverse tooth movements. So we are done with the general principles or general requirements of these orthodontic appliances. Thank you all.